Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by Katie Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists. We are KDH Collective. We're an educational business, and we are going to talk about our series, Trauma-Informed Therapy. It's a 3-part series. I can't even talk. And we're going to talk to y'all just briefly about the course so you know what to expect. So I have with me Bren Augel. Bren, can you tell us a little bit about yourself?
Hey, yeah, of course. So I am a trauma-informed therapist. I do a lot of work with pretty much young adults and adults in deep brain reorienting. And I work a lot with families, everything from the perinatal world and releasing trauma through that, and then with teens and their families and helping them through family dynamics that could otherwise be continuously traumatizing, but decreasing the likelihood of that occurring.
And we also have, she's not with us on the video, but we also have Marielle Babb. She's at LPC. She's been in the field 10 years, and she works with trauma. She does OCD. She does anxiety disorder. She does a lot, and she is really good with dissociation. So she's kind of like the expert between the three of us in that. We all work with that, but I would say that I would consider her the expert. So she's not here today, but she'll be teaching the class with us. And then it's me. I'm Keisha, Katie Holmes. I have, I don't know, a bunch of years in the field, 20 years. It's going to be 20 in March, which is kind of crazy. I specialize in OCD and trauma. So trauma is one of my most favorite things probably to work with. So I'm really excited about this course. So we're going to start, like, why would you take our course? I guess that's kind of the beginning of why, because there's so many trauma-informed therapy courses out there. So why ours, Bren?
All three of us have discussed is that we've done the years where we've made the mistakes. We've learned what's effective. We've learned what assessments need to happen and how they need to happen so that you set your client up from the beginning of your therapy with them to have their trauma treatment be more successful. So your client is not 13 years in and just starting this trauma work, but that from the beginning you can really understand and have your client join you in the self-compassion work that you're going to be doing from the beginning. That beginning, those first steps are really important, is what we've really talked about.
And I think the more we try to identify what it is, Marielle's the one that's really good at these summaries. I'll be honest. When she says it, I'm just like, beautiful. But it's this broad way that we conceptualize trauma-informed therapy work. You don't have to do trauma work in order to be a trauma-informed therapist. And it's the way that we frame it and look at it in the broader sense so that we can be more intentional when we're doing this type of work. So we're not just like, I don't know, unintentionally working here. Now we're doing this. We always have a goal we're moving towards. And so our class is to try to help you be more intentional and identify how to do it like efficiently. Yeah.
Say a really good point in something that we've talked about is you want every clinician to understand that even if you haven't identified yourself as a trauma therapist, maybe you've decided, I want to do everything but trauma. It is still really important for you to take this, at least the first part of this 3-part series, to understand if trauma is in your room. 90% of the time, it will be in your room. And I want you to know what you're seeing, what to look for, what questions to ask, and then how to get your client going in the right direction for treatment. What's their next steps from
I love this. And this, I will say, like, Bren's really good at like being specific. So she can take that broad and then get so specific. And sometimes in therapy, you kind of get lost in what you're doing. You're like relating to the client. They come in with a new problem. And then you kind of divert it and you're off doing that. And so I think by being more intentional in this way and knowing this framework, when they divert, you can know what it's about and what the bigger goal is so that you can stay on task with your client. In the course, we talk about diagnosing PTSD, post-traumatic stress disorder. We do go pretty in depth about it. Do you have anything you want to say about that? I don't use this diagnosis a lot, which is fascinating because every time we do this course, I really think about this idea. Why don't I use that? But I think we probably use the diagnosis that we are treating. And even though trauma may be a part of it, it might not be the diagnosis we give them. Okay, so with PTSD, give us some words on that because you diagnose that more than me.
I think about trauma may be different than how other people discuss it. So the way I tell my clients is in the book, the PTSD, right? If I'm giving a PTSD diagnosis, that most people are experiencing or seeing it. It's a big T is what we've always called it, but it's a trauma that everybody knows and understands if you've gotten in a car wreck or something like that.
War.
And where the way that I see trauma is the trauma on the body. So from the physiological standpoint, you can have a traumatic event, which is happening external from you. And then you have the internal trauma experience. So what the body is doing and how it's responding in that traumatic way. And so when you're looking at diagnosis, what you're diagnosing is both and. So to have a PTSD diagnosis, they have to have this event that your book has clarified as the specific event that must occur for it to be trauma. And then you have to have all these other symptoms that are happening within the body or the experience to clarify a PTSD diagnosis. Your client may still be having trauma responses within the body for a lot of other reasons that we'll go into. And so you may still be using PTSD, or I guess when I say trauma protocols, trauma therapies, even though you don't have PTSD diagnosis, but you do have to be clear. So as a clinician, particularly if you're filing with insurance, but in general, you need to know what you're treating, right? It's effective to know what you're treating. You may be looking at other diagnostics. You may, and I mean, it can be extensive from acute stress and other sensory processing things, autism, ADHD. Yes. There may be a lot of things that you're treating that have set your client up for more likely to experiencing either actual traumatic events or their trauma response in the body from things that are not traumatic events, but are triggering them.
Correct. I think the way we diagnose, me and you were talking about this, it really informs what we're treating, which is fascinating to me, right? And so a lot of the clients I work with are diagnosed late, like adult diagnosed autism. And so these people typically do not have a trauma history. And I think some of the trauma groups I'm in, they'll say, well, they must not remember it. I'm like, or it's their body that feels the experience of trauma, even though they don't meet the criteria for PTSD. A lot of what we observe is very similar. And we're still going to treat them similarly, even if they don't have that traditional trauma exposure experience. And so diagnosing is, y'all know, it's one of those gray areas. I'm an LPC, so we diagnose differently than LCSWs, which is so interesting. And we're trained to diagnose differently. When I consult, I feel like you guys are diagnosing more about what is there, where we are like, is this diagnosis harmful? What we're thinking about a lot of factors when we diagnose. I'm somewhere between the two because every time we talk about diagnosing, I'm like, it probably would be useful for my clients if I gave them the PTSD diagnosis. And I do sometimes, but it has to be severe. And for any diagnosis, I will give them multiple diagnoses if I think it's helpful in them understanding themselves. Just like autism, if it's helpful in them understanding what's going on. And so diagnosing, look, when you take the course, we're going to explore it. But the important thing here, whether they get PTSD or not, you can still do trauma-informed therapy when a trauma response is a part of it, or actual trauma has occurred is a part of what's contributing to their symptoms.
In this first intro, we want you to understand what PTSD looks like so that if you are seeing a trauma experience in your client or they've had a trauma experience, that you then know how to assess for the PTSD, know if it's there or not, and then what else are you exploring for? So again, you're informed, you're doing the proper assessments, and then you're setting up a good treatment plan. So diagnosing is important in the fact that you need to know what questions to ask. You need to understand your client experience so you can treat them well.
If they have trauma symptoms without the trauma history, that's just more data, right? I think these I think these scales, there's a lot of scales we'll talk about in it when we do the course, can be really helpful in trying to differentiate symptoms and figure out what's going on with your client. Yeah, which brings us into the dissociation world. We will talk about it. I always say the word wrong. I don't care how many times I study it. I cannot say it correctly. But that term is used so much in the therapy world now. Sometimes it's used wrongly when what we're observing is something else. And then sometimes it's underused, right? When that's exactly what's occurring with the client. And so we're going to give y'all some scales to use to try to start exploring that with your clients. Anything you want to say on that?
I also want to honor that with the rise of social media, with the rise of information, your clients come a lot more informed as well. Doesn't mean that they always know what they're talking about. And I need you to know what you're talking about. So, and they come to you sometimes in fear about certain things that they are noticing about themselves, but they are educating themselves a lot more. So I want you to be as educated, if not more educated than your client when they come to you with, oh, Miss Bren, I'm dissociating right now. And I'm like, talk to me about what you're experiencing. That way I can guide them with whether they truly are experiencing dissociation or not and what that means. So
Thank
we
you.
want you to, at least from a minimal standpoint, because in PTSD, you're going to be looking at dissociation, depersonalization, derealization. And we want you to understand what those are so that if your client doesn't know about it, you know what you're looking for. And B, if they come to you telling you they have depersonalization or derealization, kind of like the fad of being a narcissist is coming into my office all the time as well, you know the symptoms so that you can ask those good questions and rule it in or rule it out.
Well, and I feel like what you just said, so important in terms of like, anytime somebody uses the word in here, dissociation, I'm like, explain it to me, please. Because sometimes people use it spot on. And sometimes my clients are describing something in this very severe way. And what their symptom is actually really mild and not that.
Yeah.
Or the beginnings of it. And they're just like overusing it. So these are all really good discussions we'll pick apart. I think the learning process, I learn every time I present with these ladies. It is such a continual process, and we just want to start the conversation for you. So you start to kind of know what these things are. Even after years of being in the field, I continue to learn about these things. So I don't want y'all to feel intimidated by these terms, by everything we're talking about. We just want to start opening the conversation up for you guys. Yeah, the bio of the brain. We were talking about the biology of the brain. We talk about it briefly in the course. Why do we want to include this? Why do we include this in this specific course?
Well, it's one thing to understand the therapy that you're going to provide your client. And it's another thing to understand its effectiveness. So I'll say that blanket and then I'll go into some detail. So whether you are or not choosing to do trauma therapy, it's important for you to understand the basics of brain function, so that if you find someone in your office and you're assessing, you can start to help them understand themselves better and get them to a place where they're more open to the trauma work that needs to happen because you've helped them understand themselves better. So I think of our biology as more information to ourselves. And a lot of people feel very understood and heard. And maybe for the first time in their lives, they understand themselves because I bother to educate them, and we educate them on the biology of the brain. And it's super important. It gives me a lot of information on what skills I'm giving my client when I understand what's happening in their body. So we really want you to have that beginning understanding in this first course of what is the biology of the brain and how the nervous system function on a very basic level. Okay. So that it can at least help you to help your client understand themselves a little bit better,
Mhm.
or inform you on who you're referring to, or inform you on what skills you're going to give your client. I'll say the second part. You will have clients that don't want to know. Like, they don't care. I have at least one that's like, I don't want to know all that. Like, that's too much information. I'm just trusting you. Okay, cool. Well, that client's going to trust you. But most of my caseload, I'd say 90% of them have benefited so much from the biology of the brain and understanding their bodies better, understanding their reactions and their reactivity better,
Mhm.
whether it's from the trauma lens or every other differential diagnosis you can come across. That biology of the brain has been very effective in helping them understand who they are and how you're going to treat them.
I will say the biology piece, I geek out on that. When I was a new therapist, I thought a lot of things were about choice. And I'm not saying choice isn't important, because choice is a very important part of what we do. But I would really rest on almost like on this, I don't know how much conviction a human had. It's way more complicated than that. A lot of times there's a biological predisposition for OCD. We know that they have more gray matter in their brain. Trauma changes the brain. So people are behaving or having behaviors related to this change in the brain, and that's what they come in for. And I think most people have a judgment against themselves based on this, right? That I should be able to do it better. What's wrong with me? And biology of the brain just introduces this idea that you are doing the best you can. Your body's trying to protect you, however misguided this is, right? And it's just doing what it was evolutionary set up to do. Like, that's the purpose of what it does. And so I don't know, that framework is so freeing when I can get people to buy into that idea and really understand it. It changes their expectations of themselves. They're a lot easier on themselves, right? And once that warmth occurs, they can make mistakes. Um, so there for ADHD, I'm gonna use this as an example. When it was originally diagnosed, it was called moral failing disorder. It was in the 60s. I mean, this is how they viewed it. That thinking about ADHD is still in our world. And I'm sure with PTSD, it's very similar. People want them to just stop or don't behave this way or just do something differently. Um, and with trauma, why are you so overreactive about XYZ, right? Loud sounds. This is what your nervous system is doing to keep you alive. And so I think when you can teach your clients to really embrace this through, what we know, science, you start on this good foundation um, of understanding themselves and hopefully being able to, I call it own it. I don't even know if that's the right word, but take ownership for what's occurring, right? When we understand, then maybe we can slow the process down a little bit more and be more intentional in how we treat it or react to it.
Yeah, and I'll say this too. What I've seen for myself and for a lot of other therapists is when we've done our work in educating ourselves on the biology of the brain, what I hope this does for you as well through the course is um, our job as therapists is to be that warmth, loving, safe place for our clients. And that means we have to attune to them. And the only way that we can really do that in a non-judgmental way is to fully understand them. So my heart work in giving you the biology of the brain is to also open you to that non-judgmental lens of understanding your client and asking questions, or teaching them in a way that isn't for doing any more damage or any more harm to them. Because I know, young, right? Okay, that was your choice. Stop. Let's find different ways to make these choices. And then when understanding the brain and you're able to say, okay, well, when I understand the brain and when shock happens and I can show them the little diagram and that you have these choices, if you're not being attuned to. And then when I explain that to them and it decreases, yes, it decreases the client's judgment of themselves, but I have found that for clinicians, it has profoundly decreased their judgment of their client as well. So, and especially young, like the younger you can learn this, the more beautiful your work as a therapist will be. So I really believe that further educating ourselves as clinicians on the bio of our full biology and this intro to biology of the brain is to also increase your compassion in helping your clients get well.
I love that. The compassion piece, when you get into complex PTSD, it can show up. Some of the problems they have in their life show up in our office, right? And those are things that we need to help our clients with, and we need to address in a very compassionate, loving way. I mean, I do think that is our responsibility. That's
And
beautiful.
real.
Yeah. Yeah.
It doesn't give people permission to do all the things in the world, but it lets them know, I understand that it's really hard for you just to make a new choice. And
Yeah.
then it informs your skill work.
Yes.
So just
Yes.
that intro part, the importance of this intro bio work is to increase compassion for both the
Mhm.
therapist and the client.
Yes. So, and the last part of what we do is the treatment planning. So we
Mm.
talk briefly about treatment planning. It's not like extensive, but I think we're trying to introduce the idea of, God, how do we summarize that? Of how to do it effectively in a very systematic way. So you guys don't have to, I mean, this treatment planning piece took me, I don't know how many years to actually learn and articulate, in a very, like, people taught me, but I still didn't understand step 1, step 2, step 3, step 4. And we give a pretty systematic way to do it so that you guys don't have to go through what we went through, right? Quicker. So
Right.
yeah, treatment planning. What do you want to tell them about that, Bryn?
No, I think you've summarized that really well. Like the whole point of this part of the course was to take you from diagnosing through assessment to treatment planning. So now you've done the work, you understand your client, and now you know the best way to treat them, to give them where they do have choice of what type of treatment do they want to be involved in and where do they want to go for that treatment. But you understand what therapies are needed and where they're going to go now that you've done your assessment, and good direction and knowing whether or not that's with you or not. And so this whole part of the course is really to further your competence in the room, and give you a way that we look at it. But I think the whole course sets you up from beginning to end to treatment plan well. And that end is just going to summarize for you at the end whether your client belongs in your room or belongs somewhere else. And we'll
Yeah.
give you more direction on that.
And I want y'all to know, if you are someone who is trained in trauma therapy and been doing this for a long time, I learn things every time we get this course, because I think being exposed to how other therapists do this who have been in the field a long time, who I think are like super competent. I love referring to both you guys. It has enriched my own understanding of what I'm doing, changed some of the ways that I've done it, and just like continue to increase my learning. I can't even, we are alone in the office with our clients. I say this a lot, doing the best that we can. We do our little notes, we do our treatment planning, but that learning process with other therapists and seeing how you guys work, for me, it's priceless. It has added another layer of intentionality. It's made me reflect on, what am I doing? So if you're someone who's like, I don't know if this course is for me, it might feel a little underneath what I already know, I think it's a good course to take. We never stop learning, and learning from other therapists is like a really beautiful experience, in my opinion. Um, I, that open learning process continues to help me evolve as a therapist.
Equated to an experience I had, where someone invited me to a self-injury safety planning,
Hmm.
suicide and self-injury. If you know me, this is what I do every day. Okay. And so I was like, the thought of like, I don't need to go to that. I do this every day. And then I was like, no, you know what? This is a great opportunity here.
Mhm.
If there's something new, I could learn something, whatever. I went and it was such a beautiful experience. And I got new ways people said different things, new ways and different like screens and tools and stuff that they were using. In fact, the screen that I had been using forever was now virtual. And I was like, cool. Now I don't have to print it out. And so to Keisha's point,
Mhm.
if you have the thought, I'm a seasoned therapist, I don't know if I need to do this course, each of our courses does build on each other. And I have found that anytime I've taken like a 3-course series, I've in fact even taken courses I've already taken again because I want to make sure I didn't miss anything and I want to relearn it so it's in my head all the time. And anytime I've taken like a personality training or any trainings that I already know the information, I know the information better than I did the day before. And people always ask me, how do you do well in your life? I'm like, because I teach the skills that I need in my own life every day. It's in my head every day. The more you take something, even if you already know it, the more you grow in it, the more it becomes like what you just do spontaneously. It's like ingrained in you. So it's easier for me. I'm with these women all of the time. I'm constantly talking to them, constantly in the room with them. But if I wasn't, I would definitely be in the training, getting just in their heads and just the way that they say things, the same way they feel about me. It's like together we're in each other's heads. This is why I like coming to a room with you guys or coming to a virtual room with you guys, because I get to hear your words and your language and we learn from each other. I always learn really cool stuff from my new therapist coming in or my seasoned therapist, because I either get some new way to think about something or a new question that's never been posed to me before, or someone beautiful, like who's been in it forever, says something. I'm like, that's just a beautiful way to say that. Adding that to my list of ways that I say this thing.